this is our crash cart, which you should be able to find in your hospital floor. It comes with a defibrillator, and here's a pressure bag when you have to do a rapid infusion. You would put your IV fluids on the inside and then puff up the bag to the desired pressure to make them flow faster. Here's a stool for when you have to do compressions and you need some extra height to get a better deep compression. In the top drawer, we have our resuscitation drugs and antiarrhythmics. So you'll learn more about this in MCA3, your dopamine, your lidocaine, adenosine, and then it also has some heart medication like there's some nitro tablets. In our second drawer, we have our airway access. So here's an ET tube with a stylet and a place for inflation of the bag when it's in the proper place to seal the airway. CO2 detector. This is what you put on the end of the ET tube to make sure you have proper placement, and it will change color from blue to yellow. Here's your OPAs, also to keep your airway patent and open. Your lubrication for that ET tube. And your syringe to blow up the little bag on the ET tube. In our third drawer, we have our IV access. This is important to know because you need to start your infusion or any medications. And also there's some test tubes. Here's your IVs and your starter kits. And of course your flushes to make sure that the IV is usable. In this drawer we have our suction equipment to maintain an airway. Here's a Yonkar section. Also, you have some electrodes in here. And in this drawer, we have our IV fluids. This is just lactated ringers. And then there's also just some normal saline, 0.9%. And our IV tubing. And finally, this last drawer has our ambu bag and our oxygen mask equipment. I think that sums it up.